Hi people, once again it's Dr. Tung'ani. We are talking about cancer of the uterine cervix. This is part 2 of the topic. In part 1 we talked about the virus responsible for the disease and the vaccine. In this video we'll talk about screening, diagnosis, treatment and complications. As with any disease, screening is done on healthy individuals, and it is recommended that women get screened regularly after their second decade of life onwards. Various methods of screening do exist. One method is to test for the virus itself. Another method is to look for the changes the virus makes to the body cells. One way to do this is the pap smear test. Here, a few cells are picked from the cervix with a soft brush for analysis. Another way this can be done is called via villi. This is where special dyes are applied on the surface of the cervix, and the surface is then examined for abnormal changes. Now, whenever an abnormal screening test is encountered, the doctor may recommend a retest depending on the result, or they may recommend a more diagnostic approach. Further tests may be recommended. Now, diagnosis. Efforts to diagnose cervical cancer should be made where sufficient symptoms exist, or, like I said earlier, where an abnormal screening test occurs. And diagnosis is mainly made through biopsy, which involves taking a small chunk of the affected area for microscopic examination. After confirming a diagnosis of cancer, staging should be done. Staging is like a description of how far the cancer has spread, and there are 4 recognized stages of the disease. In stage 1 of the disease, the abnormal cells are still confined to the cervix, where it all began. In the second stage, the cancer can spread to the upper part of the vagina that surrounds the cervix. In stage 3, the cancer spreads to the lower part of the vagina or further to the sides onto the pelvic side walls. Here it can also block urine flow from the kidneys. In the last stage, called stage 4, the cancer can go to the bladder, or it can go to the intestines, or even distant organs like the lungs, the liver, and even bones. Treatment for cervical cancer does exist, and there are various options when it comes to this. When the early changes are detected before they become cancer, the cells can be destroyed. One of the methods is by freezing them, also known as cryotherapy. Or the cells can be cut off, or in an excision procedure called lip or conization. As a last result, the whole cervix, with or without the uterus, can be removed during surgery. Those are the treatment options for precancer lesions. When cancer is confirmed, surgery can be done for early disease before it spreads outside the cervix. Beyond there, radiotherapy or chemotherapy are the mainstay. Now, this is a disease associated with many complications, and the complications worsen as the spreads further. It can cause anemia, it can affect the kidneys, it can cause fistulas, it can give you blood clots, or it may affect many other organs in the body. Now, to end this video, let's recap a bit. We can say that most of the cases of cancer of the cervix are caused by the human papillomavirus, which by majority is sexually transmitted. There are various measures that can be taken to protect one from the virus and from the cancer. There exists a vaccine for the virus, which can reduce the chances of the disease. There are various screening methods, diagnosis, and treatment modalities exist.